Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Hematuria. Hematuria, there is microscopic hematuria. Hematuria is actually present in the blood in urine is called as hematuria. In the hematuria, we say that the microscopic hematuria, if there are more than 2 RBCs per high power field in the urine, then we call it as microscopic hematuria. If the dipstick can be positive for blood, there are dipsticks which can detect blood, and these are positive for blood if there is hematuria, but they are true positive for blood or hematuria. But there are conditions where the dipstick can be positive, but in reality there is no hematuria. That is said to be falsely positive. A dipstick is said to be falsely positive for myoglobinuria and hemoglobinuria. So for myoglobinuria and hemoglobinuria, a dipstick is said to be false positive. Then, how are you going to differentiate this? A dipstick will give false positive result for both myoglobinuria and hemoglobinuria. Now, how do you differentiate this myoglobinuria and hemoglobinuria? For this, you should do centrifugation. In order to differentiate between myoglobinuria and hemoglobinuria, first you should get the urine sample and then you should centrifuge it. Once you centrifuge it, you can see that now if you centrifuge the dipstick sample, you have centrifuged it, then the urine will centrifuge it, you will see the urine here, and at the bottom you will be able to see the red blood cells are seen at the bottom when you centrifuge it. In such case it is hematuria. Okay, even after centrifuging it, you have centrifuged it, even after centrifuging it, if the fluid is not clear, even after centrifuging it, you can see that the red supernatant is formed and also the fluid is not clear. Even after centrifuging, if you see the red color distributed in the urine, then that is myoglobinuria or hemoglobinuria. So with the help of this, you can differentiate between myoglobinuria and differentiate between the true hematuria or myoglobinuria and hemoglobinuria. Then dipstick can be negative. If dipstick is negative, and if you have done a centrifuged urine, on centrifugation of the urine, if you have seen that there is red supernatant is seen, but dipstick is found to be negative. In such case, what do you see? It's actually there is a red supernatant is seen, but the dipstick is negative. It can be seen in porphyria, beetroot ingestion, and in phenopyrazine. In porphyria, beetroot ingestion, and phenopyrazine, these gives color to urine, but dipstick will be negative in these conditions.
thank you and thank you for watching.